Welcome everyone, and thank you for joining us for today's webinar. My name is Suzanne Walker, and I'm a Senior Marketing Manager here at Jones & Bartlett Learning. And now let me introduce our presenter. Richard Riegelman is the Professor and Founding Dean at the Milken Institute School of Public Health at George Washington University. He is also author of the best-selling text, Public Health 101, Improving Community Health, as well as a short primer on population health, and an AJN award-winning ebook entitled COVID-19 Global Lessons Learned, Interactive Case Studies. He is also series editor for the Essential Public Health series, as well as our expanding Population Health primer series, all of which are published by Jones & Bartlett Learning. And with that, I'd like to turn things over to Dr. Riegelman. Dick?
Well, welcome to our National Public Health Week webinar. I'm looking at an update for Undergraduate Public Health 2022. And I'm going to start with the big news. The big news is that there are now more bachelor degree graduates than there are master's degree graduates in public health. And this chart that you have before you really shows the dramatic changes that have occurred in undergraduate public health. It was a tiny fraction until recently. In 2006, there was a national consensus conference on undergraduate public health, in which public health educators and liberal arts educators with AAC and U got together and outlined some strategies for developing undergraduate public health. And you'll notice that just soon after that, the undergraduate public health really began to take off, and it hasn't stopped. In fact, there are now just about 18,000 graduates each year with bachelor's degrees in public health, and just under that in terms of master's degrees. So this is quite a dramatic change. But it's not exactly up-to-date change, because this is pre-pandemic data. The newest data, unfortunately, this is Department of Education data, which is very accurate, but not very timely. It comes out, the 2021 data will come out this coming June. So this is 2020 data. So what I'm going to talk to you now about is data that's provided by the Department of Education and a bit more recent data that's provided by the association, ASPPH, the Association of Schools and Programs of Public Health. But this data you should view as pre-pandemic data. You should also view it as data that does not include everything. It does not include the minors, and it does not include students that are in the pipeline, but this only graduates, so new programs aren't fully represented. So we're going to start by looking at pre-pandemic data. Then we're going to think together, and I hope to get some input and thoughts from you about how the pandemic has changed undergraduate public health. And then finally, I'm going to highlight some of the areas that have that are emerging and how people are responding to the changes that have been initiated by the pandemic. This graphic shows you the number of institutions that offer a bachelor's degree, master's degree, and doctoral degree programs. And the orange line is the bachelor's degree. And it's important to recognize that the characteristics of the institutions that are offering bachelor's degrees is really very different. Master's degrees and doctoral degrees are offered by at a graduate level, usually CEPH accredited programs and schools, and they may well have undergraduate programs, not always, but often. But in addition, for undergraduates, more than half the institutions now do not offer graduate degrees in public health. They offer bachelor's degrees, but they do not offer master's and doctorate. They are increasingly being called standalone programs, and that's the accreditation term that's been used. And there are now, the best guess is that there are over 250 standalone programs, and there are slightly less than that that are part of programs, schools and programs. So the unique feature today of undergraduate public health is it's offered in many institutions that are do not offer graduate degrees. And I think this is the data that really shows the dramatic increase in institutions, and most of those are ones without graduate degrees, standalone programs. The other thing that's really dramatically changed, and it's important to know in recent years, is what's happened in the ethnic and racial mix of students, graduates. And the Black, Indigenous, people of color, the BIPOC population has grown dramatically. And the right-hand graphic shows you that today undergraduate public health is majority minority. That blue line has crossed 50%, and the orange line is slightly under 50%, and we're now seeing that a very nearly equal mix, but is slightly minority majority today. So that's a different population, and it's an important change, and it has lots of implications for the workforce and lots of implications for where public health is going. So I want to be sure that everybody recognizes that quite dramatic change that's occurred in recent years. And why did that occur? Well, it's been occurring for a long time among the Black population in particular, but look what's happened that this graphic illustrates in terms of the Hispanic population. The Hispanic population in 2013 was way down there. Today, there are more Hispanic graduates than any other ethnic group, including well, certainly more than any of the others here that shows. So basically, that's a major change, and that once again, it's something to for all of us to recognize. The nature of the population is different. The experience of the population, the student population, is different, and their ability to serve populations and new populations is different. So keep an eye on what the students are like, not just the numbers, but what type of students and what kind of background they come from. One of the other things that I found very encouraging in the changes that have occurred is that this is not a local phenomenon. This is a national phenomenon. Look at the distribution. This distribution of programs matches extremely closely the population distribution of the United States. So the increasingly undergraduate public health is where the people are, and I think that's well reflected in this graphic. One of the things that's been looked at is to try to understand what kind of public health education are people getting, and one of the ways to outline that is to think about the majors that they're taking or the specializations they're taking. And I think the biggest change, and this is only since 2016, I think the same kind of changes have increased even back to 2010 and before. But basically, the biggest increase over the last 5 years and certainly the last 10 years is in general public health. Today, and much of the recommendations and the requirements for accreditation, the advice that's been given by ASPPH, and the general thrust of undergraduate public health has been toward a generalist degree, broad-based degree that has the full range of core courses, usually followed by a series of electives. And that's gone from about 30% of the undergraduate graduates to about 45. And so that's become by far the biggest single area. As you can see, there's a lot of specializations. And I think that one of the things, a couple of things in looking at this graphic and trying to look at it closely, is that the specializations in general have remained about the same. There hasn't been the same degree of growth in specializations. And some people have said that that's a concern because, for instance, environmental sciences is an area you would hope there would be some growth, particularly with all the needs and global warming and all of the different areas that hopefully public health can contribute to. And environmental health is an area of great potential, but not much growth. Another area you'll see missing here, and I think it's also we're going to talk more about it, is there's no specializations in infection prevention and control. And that's another area that I want you to think a bit about the potential that it has. Obviously, COVID has brought that to global and national focus, but it's interesting that you really don't see a specialization in infectious disease or infectious disease prevention and control. So those are two areas where in some ways you might want to see more specialization. The environmental sciences, by the way, is not the orange in the middle. It's that very small little orange up near the top. And that's, I think, one of the areas that could certainly benefit from some additional focus. So the next question we ask is, the data that we have some data on is where do people go? 10 years ago, when we started looking at this, about half the people went to graduate school. Today, it's about 2 to 1. About twice as many people are employed as are enrolled in further study. And that's important. And so the first thing I want to look at with you is where they're going and what they're paid in terms of the employment, what we know about their employment. One of the things that I think surprises people is that they're not going into jobs that are called public health. In fact, an interesting study a few years ago by the University of North Carolina that looked at all their graduates, undergraduates, and very few of them had job titles that said public health in them, traditional public health jobs. But when they asked the students whether they felt they used their public health skills, they very much thought they did. The wide range of skills that they provide, even though their jobs weren't called public health, were very much public health skills. But look where they went to work: for-profit organizations. Not maybe perhaps what we would expect from at the master's degree level. Healthcare organizations, 28%. Nonprofits, 11%. You might have expected that in the academics, but look where the government agencies is, only 9%. Governmental public health, despite the growth in undergraduate public health, governmental public health is not where the workers are going. And that's going to be a major theme that we need to think about for the future, because that's hopefully about to change. But in the past, even up until then, only a small percentage of people went into governmental public health. Let's look at the salaries. The salaries are modest, entry-level salaries, but they're quite reliable. They provide very good jobs, secure jobs, jobs that use their skills, but they provide a modest entry-level salary. I think you can see that, interestingly, the for-profit, you might expect, get paid a bit more. What you might not expect that the government people get paid just about the same. And I think that that's why that's occurred is not clear, but it may be that only the people are going they're not going into much entry-level jobs. They're getting more advanced. Their skills are being recognized, and they're entering at a higher level in government than they would otherwise. The healthcare, academics, self-employed, the whole range are amazingly similar. And but I think that gives you a sense of the kind of range of entry salaries that people are getting in the various sectors. But what about graduate school? Well, of the 60%, the 30% that are going on to graduate school, about over a third are going on to public health. So if you multiply that, you get about 15% of the people who get a bachelor's degree in public health are going on to public health graduate school. That's an important percentage, but it's a percentage that I think many master's degree programs would like to see increase. And I think most of those are probably the generalists, because the generalist degree fits very well with the specialized nature of MPHs today. So I think that gives us some important information, is that we have a modest percentage that are going on. Most of them are going either into the workforce or going many into clinical and specialties. So that's kind of what we know about what's out there. This is to kind of give you a sense of what we know about the data pre-pandemic. So what's happened during the pandemic? Well, this is a bit more subjective, but I'm going to give you my sense of a lot of the different changes that have occurred during the pandemic that in fact affect education and undergraduate public health education in particular. And then we'll talk about some of the things, some of the responses that are happening as a result of some of these changes that are occurring. I think probably the most obvious and dramatic one is the interest in public health and the interest in public health careers. It's hard to have public health on the front page and in the center of the internet without people paying some attention. And certainly undergraduates have been paying some attention. And so we're seeing, I think people know what public health is today, not just undergraduates, but high school students, that public health is on the map. And people are saying, well, what can we do in the field? They're greatly interested in the potential for careers. And how does that manifest itself in undergraduate public health programs? Well, I think what we're seeing is a great deal of interest in students who have no intention of becoming public health specialists, getting public health degrees, interested in introductory courses. We're seeing people from that almost a liberal arts education isn't complete today without a introductory public health course. We need it's becoming the kind of basic course, I hope, that is traditionally people will take a psychology course and an economics course and a history course, etc. And I hope that today, I think it's very feasible that they'll be taking a public health course, and that's already happening. And that's a wonderful thing for public health education, but it's a stressful thing for educators because suddenly the number of people who are interested in taking the introductory courses, and not just the introduction to public health, but introduction to environmental health and introduction to epidemiology, introduction to global health, are all courses that are going to have a large enrollment. It means that there's going to be either more sections or larger sections, and a lot more interest and a lot more students who are going to want to take those courses. And that's great. Unfortunately, the universities aren't responding quite so well to the need for more professors. Even though public health education has done very well in terms of revenue during the pandemic, universities are under increased financial strain, and it's not always so easy to get to get more faculty to teach these courses. So this is a great opportunity, and it's going to take some work to really respond fully, take advantage of all of this interest. The second piece, which we're going to talk more about as we look at what's happening in these areas, is there is now a real opportunity to increase the public health job market, and not just the kind of broad market that we talked about, but what we'll call governmental public health. I think it's become very obvious that governmental public health departments at the local, state, and federal level have been grossly underfunded, and the jobs, there's going to be there's finally some attention to that, and finally some money in that. So we'll talk more about what's being done in the workforce and what might be done in the workforce in the years to come. The third area that I think is important to know, and it's maybe a corollary of the above, is that interest in public health education is not limited to people who identify themselves as public health. And the two big groups that are now taking notice and seeing public health as intrinsically important to their own field is clinicians, clinical students in nursing, physician's assistant, pharmacy, physicians, the whole range, dentists, even, a whole range of clinicians and clinical fields that are taking notice about public health and trying to integrate it into their curriculum. And the same is true of health administration. Hospitals, health plans, everybody has been dramatically affected by COVID. And I think all of these people, all of these curriculums now want education in public health. Sometimes it's called population health. But in terms of the interest in these fields, it's growing very rapidly. And once again, for faculty in these areas, there'll be more and more demand and more desire to have coursework in these areas. Another area that I think probably you're all familiar with is the dramatic changes in the acceptance of online education and use of digital materials. I think that's been across the board. But prior to the pandemic, online education in public health was largely confined to graduate education. It still is dramatically. There's been enormous growth at the graduate level in online education. But I think it's going to be important in undergraduate education that we understand the uses and think through the applications, because the changes that have gone on in students and the changes that have gone on in faculty during the pandemic in terms of online education are truly dramatic. So keep in mind how online education can supplement in-person education at the undergraduate level as well as the graduate level. Then I'd like to talk to you about some areas that I think have gotten traction that didn't have as traction before the pandemic, at least in the same way. And the most clear-cut of those is infection control and prevention. And as I say, there hasn't even been undergraduate specialties called infection control and prevention, and not much of that even at the graduate level. So the ability and the interest in creating specializations in infection control and prevention that aren't limited just to COVID, but take a broader view. Some people would call a One Health approach that really looks at where do infections, disease come from, how does it spread, how can we prevent pandemics, are really becoming the potential for specializations within graduate public health as well as undergraduate public health. Secondly, the social determinants of health have really become front and center. Sometimes the terms used are social justice or health justice, and health inequities or health equity are important. All of these terms are we're talking about the same thing with some subtle differences. And we'll talk a little bit more about this. Certainly, social determinants of health are now an essential component of any undergraduate public health program. In addition, global approaches to public health. The pandemic has made painfully clear how interconnected our health world is, and how we can't really teach public health entirely nationally, as some people have done in the past, and that a global approach is kind of inherent in public health. There was an article a few years ago called Global Health is Public Health, and I think that's an important concept to appreciate, is that we've gone global and our curriculums need to go global. And that's, I think, something that's going to be increasingly important. And finally, and this is I think going to be a very important, is that it is now, I think, on the center of the future agenda, is that governmental public health needs to be strengthened, it needs to be reorganized, it needs to be integrated, it needs to be funded. And all of these things are just beginning to happen. And if we're going to really learn from the COVID experience, we've got to do all of these, and we've got to do them relatively soon. That's going to lead us to think about what changes are going to be made in governmental public health, and how will that affect education and undergraduate education in particular. So we'll spend more time on that in just a few minutes. So we've talked about where we were before the pandemic. Here are some of my thoughts, at least, on the changes that have occurred because of the pandemic. And now I'd like to turn attention to some of the responses that we're making to that, and some of the folks in the Essential Public Health Series that have been able to take advantage of some of these important threads. Social determinants of health in health justice is now fully integrated into the frameworks for education. Healthy People 2020, which came out, was delayed. Its release was delayed by the onset of the pandemic. It was supposed to come out in March of 2020. It came out much later in 2020 and kind of continues to come out in pieces. But one of the things that has really changed in the framework for Healthy People 2020 is that social determinants of health are right in the middle of the framework. The same is true of the 10 essential public health services. Health equity, health justice is literally in the middle of the graphic for the 10 essential public health services. And they're important because the 10 essential public health services are now the framework that's used for accreditation of health departments. And so health equity has become a job not just of education, it's become a job of health departments, the responsibility of health departments. And that's going to be, we're going to see some of the implications of that in a minute. And of course, social determinants of health is not just about public health. If we're going to succeed, we have to connect with clinicians, the healthcare system, health administration. And the good news is that these terms are no longer foreign terms in these areas. They're very much a part of the thinking and the curriculum change that's going on in these areas too. And so they're the essentials of health, culture, and diversity, and the essentials of health justice are both hot off the press texts that are, I think, very much geared to the social determinants of health. Obviously, infectious disease epidemiology, infectious disease control is front and center, and the relationship to COVID, and tried to put together case studies that will really make this come alive, different interactive case studies as part of COVID. But there are a series of additional Jones and Bartlett publications, including the Essentials of Public Health Biology and other infectious disease epidemiology texts that are very relevant for core curriculum, but also important for any specialization in infectious disease epidemiology that people are interested in developing. So infectious disease epidemiology is certainly something and needs to be part of an undergraduate public health education today. And often it will include a focus on One Health, the relationship between human health, animal health, and ecosystem health. And this movement has grown considerably during COVID, and much of the international effort to reframe the international health regulations has been built on a One Health framework. So that's an area that you might want to think about including in your curriculum too, the whole field of One Health. Finally, public health careers are now something that students are really interested and really need to know more about. I can't tell you how many people through the years I've heard say, well, I kind of found out about public health late in life. I kind of slipped into it. I didn't know about it when I was in college and beyond. But today, students know about the terms, but they probably don't know about the careers. And so there's an increased emphasis and importance on education providing them with some entree to what the fields are like. And there are a lot of ways to do it, but we've also tried to include this now increasingly in the Essential Public Health series. For instance, Global Health 101, Richard Skolnick has done a really great job of producing 2025 profiles of careers in public health. And it's a wonderful piece of work in terms of getting a real sense of how you go from your education to a career in global public health. Lisa Sullivan, has in her new edition that's coming out soon, has a chapter on careers in biostatistics, which is not always an obvious direction for students, but a very one with great opportunities. So that's will be an important resource. And finally, the essentials of public health. Burkhead and his colleagues is really about governmental public health, and it really is a state-of-the-art book on how governmental public health works. And so that this is another book for those people who are interested in knowing about the careers and what governmental public health does, and increasingly about the opportunities that will hopefully be provided by governmental public health that we'll talk about in just a second. Okay, so those are some areas that I think are important. But let's look at how public health, the pandemic, and are beginning to change the institutions, the educational institutions, the health workforce, the health departments. An institution that really hasn't been part of public health is community colleges. And that's really has been quite a loss, because about half the students in the country in post-secondary education are in community colleges, and they are majority minority, and they're upwardly mobile, and they want good jobs, but they also want to go on for further education. So it's important that community colleges not be left out. In principle, that's happening. Framing the Future of 2015 by the Association of Schools and Programs of Public Health, ASPPH, fully recognized community colleges as a part of public health. I think that's been recognized in principle, but it hasn't really fully matured yet. But COVID is pushing it in that direction, because when you look at who works for health departments, a substantial percentage of the employees have a community college degree. They don't have an MPH, and many of them don't have a bachelor's degree. So there's increased recognition of the need for associate degree students, including both transfer students and job options. The CDC is getting into this act, and it's been a long time in coming, but the CDC also has now beginning to focus on community colleges. And they funded their first major project in this area called Project First Line. And Project First Line was really an attempt to get infection control and prevention control into the curriculum of community colleges, and including nursing and allied health. And that's where the health curriculum is in community colleges, predominantly in nursing and allied health. And the CDC is putting a lot of funding and a lot of effort into developing curriculum that can be used, and developing relationships that can mature with community colleges. The organization that has been most active in the community colleges is called the League for Innovation in the Community Colleges. And it's really the academic organization of community colleges, representing the schools themselves. And they're now collaborating with ASPPH on workforce issues, including the roles of associate degree graduates. So the importance of community college and public health is just beginning to be really focused on, and I think you're going to see a lot more about the importance of community colleges and public health in the coming years. And COVID has certainly propelled that forward. The second kind of initiative and institutions that are really active in this area is the health departments. As you probably know, we really have a quite complicated, complex governmental public health at the local, state, and national level. And each state does things a little bit differently, sometimes a lot differently. And so that there are lots of efforts that need to be done to coordinate the public health workforce efforts. But there's also an awful lot that needs to be done to support them financially, and provide career directions, and provide flexibility in hiring, and a whole variety of things that are going to beginning to get attention. The first really substantive step in that direction occurred in 2021 with the American Rescue Plan. Over $7 billion was allocated to support public health workforce efforts. And approximately half of that has been directly allocated to local and state public health departments to create permanent positions over a 3-year period. So we do have a money flow coming from the federal government to support state and local hiring, and all that has to be continued. And but there is a 2021, 22, and 23. There is funding to bolster and make permanent a whole jobs that were created as temporary jobs during the pandemic. So it's beginning to be financed, but that's going to only be the first installment if we're going to do things right. So that money is being allocated for permanent funding of positions, delineation of roles. That's one of the things that is going to be needed beyond this money, is the delineation of roles between graduate and undergraduate degrees. Governmental public health has the job descriptions were largely developed in the era where MPHs was the standard degree. And there needs to be a real relooking as part of the changes about the delineation of roles and identification of what somebody with an undergraduate degree, a bachelor's degree in public health, and an associate degree in public health can do, and a much greater degree of hiring flexibility. So hopefully that's going to happen. Those of you who've seen the headlines in the last few days, the CDC is now going to be doing a full look at their own structure. And I think that's going to be happening throughout the country, is that the traditional models for some people call siloed activities and siloed funding in public health departments is hopefully going to be a thing of the past, and we're going to have greater flexibility, greater delineation of roles, and far more funding go into the workforce. And one of the things we can just think about and discuss in the question period is what does this going to mean for undergraduate public health education? ASPPH is now in the process of looking at developing a broad public health workforce initiative, one that incorporates community colleges, workforce representation, and to try to understand what ASPPH can do to direct public health education more toward the public health workforce. To complement that, a McKinsey & Company, a private consulting firm, has recently done an important consulting report that looked at and made really quite objective recommendations about how to invest in health departments and where the greatest area of need. And the next chart, I think, kind of summarizes what they found. There's a lot of information here, but basically the darker and the bigger the circles are, the more the health department said, we've got this, we were okay, we have strength in these areas. And they looked at a whole variety, looked at the fact that very small health departments, small, medium, and large. And then they looked at the different areas. And as I analyze this, I see there really are, you can group these and kind of think of this conceptually. Health education, maternal and child health, and emergency preparedness are traditional areas where public health has actually been funded reasonably well. For instance, emergency preparedness after 9/11, Homeland Security provided a large quantity and still do provide a substantial percentage of the funding for local and state health departments. So it's not surprising that when asked about these areas, the health department says, yeah, we're okay. Now, emergency preparedness means things like bioterrorism, hurricanes. Unfortunately, it didn't mean things like pandemics. But in terms of the traditional preparation for emergency preparedness, those areas are at least adequately covered in the perception of the health departments themselves. Then there's another set of them that come kind of in the middle: environmental health, communicable disease, chronic disease, epidemiology, laboratory sciences. These are all traditional areas where public health was expected to perform. And in general, the The larger the health departments, the more that was expected from them. These are areas that today look underfunded. They might not have looked underfunded 5 years ago, perhaps because what they needed to do was not what it is today. Environmental health is now going to include the implications of climate change. Communicable disease control obviously includes a lot more than it used to. One example of that is wastewater monitoring that is now a common and very important part of surveillance. So that there's going to be in epidemiology, laboratory, all of these areas are might have been borderline adequate before the pandemic. They're not adequate today, and they're going to need considerable funding. A third set of areas to think about is areas that really weren't part of the mandate of health departments at all in the past and really need to be up to speed. Health economics, health equity programs that look at health inequalities are really weren't part of the agenda until recently. In addition, the rudimentary nature of the data systems that were available throughout the public health systems has become very much to light. And there's going to be a need for a tremendous investment in technology and in education for the availability and use of data systems in public health and in governmental public health in particular. So if you look at that as those three kind of ways to think about these subdivisions, I think you'll see that there's going to be a great deal of need for not only bolstering traditional areas, but developing new areas. ASPPH has really moved to the center in terms of trying to look ahead to undergraduate public health and what it can do and what its role can be and how it can continue to prosper. In 2015, ASPPH set up an undergraduate public health network. Today, there are nearly 200 bachelor's degree programs that are members of this network. Importantly, it doesn't just include members of ASPPH. ASPPH membership is made up of institutions that have graduate programs in public health, programs in schools. But the standalone programs, the programs without bachelor's degrees, are very much welcome in this network. This network is sponsoring and has been sponsoring for several years an annual undergraduate public health conference in late September, and it will be it will occur again in late September, early October of 22. I expect the dates in place to be announced very shortly. What's different is that it has been online for 3 years. It has been virtual for 3 years on the pandemic, so it will be time now for it to be in person. ASPPH also gives an annual award for excellence in undergraduate public health. And they also sponsor a program called This is Public Health. And This is Public Health is really an effort to get to students, to get to high school students, to get to college students, and it uses all the social media and videos and all kinds of stickers and calendars and all of the ways to get students interested. And they also have an ambassadors program. These are graduate students, there are over 40 of them, who have a role in trying to interest and educate students about public health. And that's increasingly an important program. And if you are interested in either of these, you should look on the asppph.org, which has a lot of information. One is it has This is Public Health, and there's a special website called This is Public Health, one word, .org. And that in the ASPPH websites has a lot of information on the This is Public Health, on the Student Ambassadors Program, as well as some of the other activities we've talked about. In addition to the undergraduate network, there has been a great deal of interest in public health education internationally, globally. And the big event in that area occurred in 2020 when the Global Network for Academic Public Health, usually called these days the Global Network, was set up. And it's actually been quite a remarkable achievement. In a very short period of time, the educational organizations, Europe has one called ASPER, which represents the schools and programs in Europe. There are a couple of them in Asia, Africa, Latin America, and Australia in the Pacific area. All of these organizations came together and are now constituting the global network. And they do two kinds of things so far. One is they're doing joint policy statements that I think do have weight, considering how broad-based they are. And they have done a new program called This is Public Health Global. And this is an educational program. And it really does represent the kind of efforts that have gone on, built on This is Public Health, that was a U.S. enterprise. In 2021, the Global Network funded 20 projects around the world that were aimed at increasing public health visibility and public health education in all continents and 20 different educational organizations developing these. A second round of grants is planned for 2023. So public health education, the growth, the enthusiasm, the energy that's going on into undergraduate public health education is beginning to have its influence globally. Finally, last but not least, is Council on Education for Public Health. And I think it's fair to say that CEPH has really taken on undergraduate public health and integrated it into their efforts. It is the programs in schools, those that are the graduate programs in schools, have their undergraduate component accredited as part of their overall accreditation. So that's built into being accredited as a graduate program. If you have an undergraduate, most do, you then have that reviewed along with your graduate program. But CEPH has made a big effort of late to try to move into accrediting standalone programs. And today they have about 25 that are accredited. And you can find those on ceph.org. And that's a new and growing program in terms of representing the accreditation. That's still a small percentage of all of the undergraduate programs, standalone programs as they're referred to, but it's a growing component. The CEPH has provided a consistent framework that was really adopted in 2016 and has really so far stood the test of time. The revisions that occurred most recently in 2021 were technical revisions, and really didn't have had really no changes in competencies. So we're going to have some stability in the expectations from CEPH for undergraduate public health from 2016 until the next full evaluation, the next new revision of the accreditation requirements, which will needs to be completed by 2026. So in terms of changes, in this area, we actually have some stability for a period of time. So I hope that gives you an overview of the where things have been, the impact of COVID, at least as I see it, and some of the initiatives that are underway to try to respond to some of these enormous changes and enormous needs. So with that, I will turn things over to Suzanne Walker, who's going to tell you a little bit more about the Essential Public Health series.
Great, thank you, Dick. We've also had a number of people interested in getting today's slides, so we will share them with you in a follow-up email with a link to them. So as I mentioned in the beginning of this presentation, Richard Riegelman is the series editor for our popular Essential Public Health series. And here are some of the key titles you see here on the screen. And it represents just some of our most popular titles. However, really the series spans the entire public health curriculum with close to 20 different titles in different courses in the curriculum, from Introductory Public Health, Epidemiology, Global Health, to Healthcare Ethics, Healthcare Biology, Research Methods, Health Behavior, and more. So that just kind of gives you a sense of the breadth of this series. But I'd like to just give you a little quick overview of it. It's really geared specifically to undergraduates and offers a very clear, consistent approach that brings public health to life through case studies, short vignettes, and real-life examples. It's also written by authors who are well-known experts in the field. For example, Bob Freese on epidemiology, Lisa Sullivan on biostatistics, and likely some other names you'd recognize. Not only is it designed to meet ASPPH and AAC&U's recommendations for undergraduate public health, but it meets our rigorous requirements for producing quality materials in teaching and learning. So for 2022, I think Dick gave you a preview of some of these titles that are coming out. We have Essentials of Health Policy of Law, which just came out last month by Sarah Walensky and Joel Teitelbaum. This has been thoroughly updated to include a lot of new and updated content and data in areas of national state health reform, healthcare delivery and public health systems, policymaking process, the ACA's effect on Medicare, Medicaid, CHIP, individual rights in healthcare, and more. They've also added a brand new chapter on health advocacy, which I think is a great one for undergraduates in that it really teaches them the art and skill of advocacy. Dick mentioned the biostatistics in public health having a brand new chapter on careers, which is great for undergraduate students choosing a career. But this book has also been updated with new cases on COVID-19 that highlight the importance and practical applications of biostatistics in addressing the pandemic. It also has, she has also included 2 hands-on workbooks within the ebook. One is an updated Excel workbook, and another is a brand new JUMP workbook, both of which have exercise using statistical computing, using those different software options. Another thing to note is for the first time ever, we are offering students a free JUMP student subscription with the purchase of the book or the ebook. So students will have access to SAS's statistical discovery software when they buy the book or ebook. Dick also mentioned the Health, Culture, and Diversity book. As the title implies, this book examines what is meant by culture and the ways which culture intersects with health issues. And then it explores how public health efforts can benefit by understanding and working with cultural processes. So this is a long-awaited new edition of his popular book by Mark Edberg. And he has, within the book, focuses on 4 key public health issues where culture and health intersect. So it's something that students can really relate to. These areas are HIV/AIDS, obesity, youth violence, and the COVID-19 pandemic. And he really highlights the content in the book with real-life examples and profiles, as well as exercises and activities that help readers in understanding the concepts and applications. Just to point out, so we have our one-stop resource for undergraduate public health is our Essential Public Health website. On the site, you can learn more about the individual titles in the Essential Public Health series, but you can also access a whole range of resources which are linked to in the whole resources section of the site. So maybe something that you want to take a look at, and you'll find some additional resources for undergraduate public health. And one final thing I want to talk about today is Richard Riegelman's AGN award-winning ebook, which he mentioned briefly, and I mentioned at the beginning as well. As COVID-19 was impacting us all in 2020, Dr. Riegelman saw the opportunity to create case studies to teach a wide range of students about COVID-19. The result was this carefully crafted, regularly updated set of 7 case studies, which is designed to, which is enhanced and supported by faculty resources. These case studies were most recently updated in January 2022 and include a final case study entitled Pandemic 2030. which looks at the future pandemic, how the future pandemic might have been prevented using what we've learned from COVID-19. So it's a nice capstone case study to the range of case studies that he's included in the ebook. All 7 case studies are going to be updated again in August 2022 in time for fall classes. And we'll also include updates on Omicron variant as well as other hot off the press topics. Finally, one thing I just want to point out to you is that this is available, this ebook is available at no additional cost, excluding inclusive access when it's bundled with the Jones and Bartlett Learning text. If you wanted to use it standalone, students would pay $12.95. But if it's bundled with the Jones and Bartlett Learning text, we can bundle it for free. So it's a great way to add that coverage without really costing your students much money. And there's great faculty resources that support it as well. So with that, I'd like to kind of turn it back to you and let you ask questions of Dr. Riegelman. I do have one right here. How should associate degree programs better respond to public health industries?
Well, I think one of the things that distinguishes the community colleges is that their focus on jobs. They feel a strong responsibility to either get students the ability to transfer to a bachelor's degree program or get a job right out of school. I think that the restructuring of governmental public health is going to make a big difference because there really haven't been job descriptions and jobs that were specifically aimed at community colleges. And I think that's what's got to change and is going to change in the coming years. There's been a lot of effort and continue to be effort at encouraging community colleges in developing public health. It's been slow. I think it'll be a lot faster, and as the connections are made between the job market and the community colleges, because that's what they're looking for. They're looking for transferability and jobs.
There's one question. How are accelerated masters counted? Example, 3+2 or 4+1 programs?
Well, for better or worse, that's a institution by institution decision. I think it is. You are putting your finger on an important issue, though. One of the ways that institutions are trying to connect undergraduate and graduate programs is through either a 4x1 or a 3+2 curriculum, and that basically means that the bachelor's and the master's really have to very tightly work together. And I think that's a good thing. So I think that you're going to see more of that. Clearly, 15% of the undergraduates going on to graduate school in public health is not a big number, and there's a lot of potential for growth. So those programs, even though they're each one is a little different, they're worth paying some attention to.
Great. There's another question here. How can our undergrad programs better collaborate with the World Health Organization and other global health organizations?
Well, I think that one of the organizing framework today that exists for undergraduate public health is the Undergraduate Public Health Network that ASPPH has put together, and I think, unfortunately, it suffered a bit from the pandemic because there were no meetings together. It was more difficult to really develop an agenda, but that's going to be happening. I'm quite confident in the next year. So I would say that one thing to do, at least, is to raise that agenda at the undergraduate network. That might mean connecting with the global network. That both of which ASPPH has been very active in. The global network is doing its best to get WHO and other international organizations to talk to and maybe connect with educational institutions around the world. The disconnect between the public health workforce and the public health educational institutions is by no means a U.S. phenomena. It's something that is an issue all over the world, and I think that between the undergraduate network and the global network that ASPPH has been so active in, I think there's a considerable opportunities for the future.
Great. Here's another one. Traditionally, nurses have provided public health and are educated to do so. How do you see other professionals interacting with nurses, or do you see nurses continuing to provide public health? Thanks.
Well, clearly, nursing has a strong tradition in public health. They may have traditionally made up a considerable percentage of the workforce in local and state health departments. So the role for nurses is not going away. In fact, I think there's every reason to think that it's going to expand. Nursing, I think, so clearly with the pandemic, nursing and nurses have come to recognize the critical importance of public health, and the career opportunities will hopefully follow that.
I think that about covers it. I want to thank everybody for your questions and comments, and I want to great thank you out to Dr. Riegelman for a very informative and insightful presentation today. Dick, would you like to say something?
I would hope that you'll all have lots of thoughts and ideas that we didn't get a chance to explore. Please don't hesitate to email any of us to follow up in terms of questions you have, or connecting with the JBL account managers, the sales reps, who I think can provide you with a great deal of information on the Essential Public Health Series. So I wish you all the best in your work in undergraduate public health.
Thank you, everyone. Our contact information is on the screen, as well as our sales reps' contact information. I want to thank you all for joining us. This ends today's webinar, and have a wonderful rest of your day.